Hello, my name is Anand Srivastava, and I am an assistant professor of medicine in the Division of Nephrology and Hypertension at Northwestern University Feinberg School of Medicine. I wanted to take some time to discuss some updates regarding coronavirus disease 2019, otherwise known as COVID-19, and how the disease can affect your health, and in particular, your kidney health. As you may know, COVID-19 is caused by SARS-CoV-2. And COVID-19 causes a viral illness with symptoms that can include fever, chills, muscle or joint pain, headache, nausea, vomiting, diarrhea, cough, or shortness of breath. Unfortunately, COVID-19 can lead to a number of adverse consequences. We know that individuals who are older, male, of non-white race, have a higher body mass index, and have other medical conditions such as cardiovascular disease, active malignancy, diabetes mellitus, and hypertension are at increased risk of developing a more severe illness from COVID-19. One risk factor that is often overlooked is that individuals who have chronic kidney disease, who are on dialysis chronically, or who have a kidney transplant, are also at increased risk of a more severe illness from COVID-19 or at risk for adverse outcomes from COVID-19. COVID-19 may lead to a significant amount of inflammation in the body and lead to liver injury, heart injury, stroke, low blood pressure, blood clots in the extremities or lungs, pneumonia that can progress to become very severe and cause acute respiratory distress syndrome, and death. Due to the significant level of inflammation in the body, we see that patients with COVID-19 also develop acute kidney injury. Acute kidney injury is a syndrome where the kidneys are damaged in the short term, and this injury can lead to the need for dialysis. In studies performed using data across the United States, we know that acute kidney injury can occur in nearly 50% of patients with COVID-19 who are hospitalized. In patients who are critically ill, requiring admission to the intensive care unit, we see that the need for dialysis can occur in over 20% of patients with COVID-19. We are in a pivotal time to protect the public health of individuals at risk for COVID-19 with or without kidney disease as we head into the winter months this year. It is clear that we are experiencing a surge of COVID-19 cases in this country that is larger than when this pandemic began, with now over 100,000 new cases of COVID-19 daily. In our state of Illinois, we are also seeing a rise in the number of cases, with over 6,000 new cases of COVID-19 daily. This surge will translate into more hospitalizations and, unfortunately, adverse outcomes for our patients. While studies to determine what treatments may be effective for patients with COVID-19 and to identify a vaccine to prevent against COVID-19 are ongoing, here are some well-known practices that have been proven to be effective to protect yourself and the health of others. Stay home if you are able to. Wear a mask or a cloth that covers your nose and mouth when leaving the house. Practice social and physical distancing of at least 6 feet and limit close contact in public places and avoid crowds as possible. Wash your hands often. You can also call businesses ahead of time to ensure they enforce safe practices against COVID-19. Please ensure that you have a sufficient supply of medicines. Continue to take your prescribed medications unless your healthcare provider instructs you otherwise. If you are receiving dialysis, do not miss treatments. If you have had acute kidney injury related to COVID-19 with or without recovery of your kidney function, then you should consider seeing a kidney doctor if you have not already. I know these times are difficult and uncertain, which can bring significant stress and anxiety, but we believe that taking these steps will help protect your health and the health of others. I wish you and your families a safe, healthy, and wonderful holiday season.